Greetings, Chamber friends. This is Jennifer with the Burnsville Chamber of Commerce. Thank you for joining us today for our business briefing. We are reviewing today the timeline of Minnesota workplace mandates, and our speaker today is Sandra Schlaefer, one of our fellow chamber members with King & Companies, and she's got decades of invaluable experience in insurance and HR consulting, and we're so grateful that she's here today to talk us through this. Take it away, Sandra.
All right, thanks, Jennifer. So let's go to this slide here. We're going to just kind of overview of what has already passed and then what is passed starting for January 1st of 2026. So July 1st of 2023, there's a ban on non-competes, so new non-competes. And then, so keep in mind on this, on non-competes, is that you can, if you have one that's currently in place, you're fine. But anything that's new, a new non-compete as of July 1st, there aren't any. So there are some exceptions though, like if you sell your business in your purchase agreement, you would want to address that. So if you sold your business, the person that purchased it from you, you could not also then just set up shop right next to them. And then there would be some other type of exceptions, of course, for protecting your information, any of your client lists, etc. So just keep in mind, no more new non-competes with an effective date of July 1st or July 1st, 2023. Okay. So also July 1st, there is legislation in the state that says that you have to provide an employer notification at time of hire, and this does impact all size employers. You need to provide private space for breastfeeding for employees that have an electrical outlet. It could be by a workspace, etc., but it needs to be private. And it cannot be in a bathroom or where a toilet is installed. The next legislation is cannabis in the workplace. So that's legislation started August 30th of 2023, and it really is protecting people, employees, for participating in legalized cannabis for non-worked hours. But there are some exceptions to that rule. So for pre-employment or routine screening, so if you have any type of safety sensitive type of positions that could provide some type of threat to the public. So safety sensitive positions, or like a peace officer, so you can still do your testing there, or a firefighter, or any type of face-to-face type of training, education, consulting, or provide medical assistance for children or vulnerable adults or patients receiving medical care. Or positions that require a commercial driver's license, or positions that are funded by a federal grant, or positions for the state or federal law that requires that cannabis testing is needed of that particular job applicant. So if you are using like verified credentials or another type of a third party for doing your background checks or your drug testing, you're really going to want to chat with them as to what the process is going forward for your particular industry and the type of employees that you hire. Okay, next slide. Captive audience, there's a meeting ban, so that went in effect August 30th of 2023, and employers cannot force employees to attend a meeting, whether it's a political meeting or religious meeting, and this was legally challenged. However, it was upheld. And so just keep in mind, you cannot enforce, and employers cannot enforce employees to attend any type of political or religious meeting. To close the gender and gender pay gap, you cannot ask an employee what their pay history is. You cannot also, if you are calling for references to verify employment from for an employee that you're going to hire, you cannot ask what the pay was that when they left that organization as well. So the next slide would be the safe and sick time legislation. And that would affect January 1st of 2024. And for each employee that works 30 hours, then they have accrued 1 hour of this ESST up to 48 hours annually. And they can carry over so that there's a maximum of 80 hours. However, what happens is if you front load this benefit 80 hours in the beginning of the year, then you don't have to worry about anything carrying over. And keep in mind, people are still eligible just for this benefit so remember 1 hour for every 30 hours week is 30 hours that they worked is what they earned. And this applies to all small employers as well as large employers. So there was back in January, you had to post, there's an employer documentation that you provide to the employees, letting them know that they do have access to this benefit. The one thing with this legislation that did change, which was a positive, it is no longer required to be actually on that employee's paycheck. So in the beginning, when this law started, you were to show how many hours they're eligible for and what that accrued amount was. And that piece of legislation has been removed. Minimum wage changes. So there, as of January 1st, so this last year in January 2025, the new minimum wage is $11.13 for employees. However, there is a training wage for workers under the age of 20, and that is a 90-day training wage, and that can be $9.08. So keep in mind, we used to use the word probation period, but now the word probation period is getting replaced with introductory period or a training period wage. Okay. Oh, January 1st. So not only did we have the you couldn't ask what an employee when you're hiring them, what their wage was at that last employer. But now when you post jobs, if you have 30 employees or more, you have to post the salary range. So it can't be depending on qualifications. It can't be just a starting with depending on qualifications. It must actually have the start and the end pay range, salary range listed. And then you also have to give a general overview or description of the benefits that job would also have available to that possible new hire. Worker misclassification, we still have this legislation. This kind of goes back and forth through both state and federal law quite often. And there's a new contractor test, especially for construction industry. And this testing, this new law went in effect March 1st. And really all it gets to is make sure if it's an employee's 1099 versus a W-2. And if they're in W-2, they're eligible for unemployment if applicable. So it's still regarding worker misclassification. Okay. The Secure Act is available for employers that have over 5 employees. And what it is you must offer, now it says participate here, but it's offer, you must offer to your employees a retirement program. And what it is you can offer to them, but they're not required to elect it. So what happens is the state of Minnesota created another social program called the Secure Choice Retirement Plan, which is a Roth IRA or traditional IRA. And what happens is you have to provide your employees as of January 1st, if you have over 5, access to this program or another program. So if you have a current 401k or a SEP IRA program, or if you currently are offering employees IRA options, then you are already in compliance. If you are an employer that is not, you don't have to choose a secure choice retirement program. You could choose another type of IRA program. Just contact your financial service professional and they will be able to get you whatever mutual fund company that would be best suited for your organization. And you're going to offer it to them. So say you have an employee, you're eligible for this because you have 5+ employees, and that employee doesn't want an IRA, then there'll be some type of application that says, hey, you gave it to them, but they declined. So there'll be some documentation that will be required that you'll need to keep that's showing that you did do a good faith offering and they just did not want it. Now, if you are going to, if you do fall in this 5+ employees, or even if you're under 5 employees and you want to offer an IRA, you as employer typically are not going to have any charges, like you would with like a 401k. But what you would want to do is this summer, just get that program in place because there's going to be a huge piece of legislation that we're going to talk about that goes in effect January. And this is a little piece of legislation. So get this summer, if you don't have any type of retirement program and you do fall under the 5+ employees, just get that set up. It's super easy to get set up, but at least that would get set up. You can get it set up earlier with even a August 1st effective date if you want, or this fall before January 1st. So that's the Minnesota Secure Choice Retirement Program. And our biggest piece of legislation, January 1st of 2026, paid medical leave law. There is a notification, and I'm going to go through each of these slides, but there is a notification December 1st that you have to provide to your employee telling which direction you're going under this paid leave law. So what it is you get up to 20 weeks of job protected paid leave. And actually it is 12 weeks of medical and 12 weeks of bonding with a cap of 20 weeks. And that is in a 52-week period, not a calendar year period. And it covers serious health conditions for you as a person, but it also covers you as for caregiving as well. And it is funded by a payroll tax, and that is a 0.88% that is shared between you as the employer, and the balance is the employee, the 0.44%. Now, small employers do have a little bit of relief there, but we'll go to the next slide. So here's the breakdown of medical leave. Is care for an individual's own medical condition. And then that's 1 to 12 weeks medical leave. And then the family leave is 1 to 12 weeks, which could be for somebody else. You're caring for somebody else, which is a much broader definition than our FMLA leaves. If you're eligible for that, FMLA goes when you have 50 employees within a 75-mile radius. This paid leave law affects all employers. If you have a W-2 employee, you have to be in compliance with this law. So the family leave also includes bonding, which is a huge one because bonding isn't necessarily covered under FMLA leave. And then active duty, and then safety if there was like abuse, domestic abuse, a sexual assault, etc. That you have an opportunity to take time off. But even though they're 1 to 12 weeks each components of this leave, you can't have more than 20 weeks in a combined 12-week or 52-week period. Next slide. Everybody's covered pretty much. It's easier to say who's not covered. So federal employees are not covered, and the reason why is because this is a Minnesota state law. So state law employees are also covered. There are some exceptions for hospitality workers, seasonal, and railroad employees. But otherwise, everybody else is eligible. There are some people that can opt in. So say you're an independent contractor or you're self-employed, and and tribal nations, you may be able to opt in to this program. So what it is you get 90% of your usual wage, up to if you make about $32,000 a year, it's about 90%. And then if you make about 70,000, it goes up to 66%. And if you make about 100,000, it's 50%. So these are all based on statewide figures. So this $1,372 per week number, or the 5.3% number. These numbers are all set by the state. So the next slide. So what happens is if an employee does go out on leave, then it gives them job protections that they are eligible to be restored to their same position for the same pay when they return after leave. Now you can see where there could be some hardship there if an employee was out for those, say, 20 weeks and you had to replace them, and now that employee came back, and uh, so there could be some additional costs that you have for training, the replacement for a while, or what the plan of attack is, what you're going to do with that employee that was in that replacement position. And that job protection for the employee actually begins 90 calendar days from the date of hire. So if they started with you and they were brand new, and they hadn't been there 90 days then, and they're still eligible for this law, then they would not be able to not be, they would not be required to be restored. But, if they were with you 90 days, then they are required to be restored. Okay. 2025 applicable plan applications open, employer exemptions in July. Okay, so equivalent plan simply means an insurance contract. So whether that's a Lincoln insurance policy, a MetLife insurance policy, um, Guardian, etc. That equivalent plan really means just an insurance company. And that's 2025. So what you want to be doing now is kind of getting your ducks in a row. And we have some other slides after this that we'll go through as to how you do that. Because keep in mind, this is the first pay reduction starts January 1st of 2026. So you're pulling that tax out of that employee's paycheck, and you're either going to be giving that money to quarterly in April to the state of Minnesota, or you're going to be giving it to, i.e., an insurance company, the equivalent plan, the insurance company. So the benefit and leaves available to Minnesota is January 1st. So say that you take out of the employee's paycheck for January 1st, but January 1st they go out on leave, they are eligible even though that leave has not been funded yet through the state or through the insurance company. There is going to be some small business assistance available. So think of hotline or maybe some enrollment areas across the state. And the first quarterly premium, so once you as the employer start pulling that money out of the employee's paycheck, holding on to it, you will be submitting it somewhere through the state or the insurance company. That first quarter premium, so think of like unemployment, April 30th of 2026. Next slide. So what the state or the insurance company is going to need is some type of payroll deduction and premium payments. So there's going to be some type of reporting, wage reporting. So think of like uploading your quarterly tax and wage. There will be some type of mechanism. So whoever you use to do your payroll, there will be a line item, just like there is for our unemployment and everything, that will show the amount of tax coming out of the employee's paycheck. And then that money that's pulled out of the employee's paycheck will end up going again to the state, quarterly, or going to the insurance company quarterly. There will be leave administration. So you have to think through your other leave programs that you have, whether you have PTO or if you're eligible for FMLA. And how are these employees going to be able to access their other benefits that are available to them? And then you might also have short-term disability plans that you need to change, because if you have employees that are lower wage, maybe they're under 70,000, then do you even need that short-term disability contract anymore? But if you have some employees that are on your staff that have make over 100,000 or over 70,000, then you might just change that short-term disability policy and carve out that population employees that would be considered high wage earners, and then nobody else would be eligible because they're going to be covered under the paid family medical leave at that 90% or 50% wage replacement. But that higher wage earner is only going to get 50% wage replacement. So you may still keep your short-term disability for that additional amount. that they would be eligible for. And your short-term disability premiums are going to go down, 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 down because you're covering less people and then you're changing the benefit. And then your long-term disability plan may also be reduced in premium because you are, once this Minnesota paid leave law, depending upon the type of leave, if it's for yourself, then you might be changing your long-term disability waiting period too. And then what do you do to support the employee when they say they're on leave? They submit a claim, they're on leave. They're either submitting the claim if you're buying it through the state, and you as the employer are working with the state, and the employee is working with the state, or you're working with the insurance company themselves. Then what are you doing to support the return to work? So when they come back to work. And then there'll be some workplace posters. And then, like I said, December 1st will be that employee notification that's required. And you'll be telling them, the employees, are you buying this policy through MetLife or Guardian or wherever, or through the state, and how they access benefits. So the state will be coming with some more collateral material. And then the insurance companies will have it as well. And then collaborate and improve. So this is brand new legislation for Minnesota, and apparently even that 0.88% may not actually fully fund the program. So since it's a tax, keep in mind that if there's not a big enough piece of pie to cover all the claims, then the taxes, of course, would be increased as well. And then they will continually do improve their processes, as well as the insurance companies will improve their processes over time. So even though this is new legislation for Minnesota, this legislation is already in place in a handful of states and many more states as of January 1st of 2026. So a lot of these insurance companies are already have these processes in place as to how the claims and the customer service and everything is going. Okay, next. So wage reporting. So paid leave will be financed by, again, insurance premiums. So it's going to be a tax collected from employee payroll deduction and employer contributions. And the premium rate is 0.88%. So when we're looking at different insurance companies for a larger, for an employer, if an insurance company says my rate is 0.83%, well, then, you're probably going to go with the insurance company versus the state program. And the rate will change depending upon the industry. So if you're in healthcare services, your rate might be higher. If you're with an insurance company, if you're in other industries, it could be higher. If you have all female population, childbearing years, the rate could be higher. So it's really important this summer is to have your, know what the insurance company's rates are coming into play at to determine which direction you're going. There is the premium rate is applied on all wages up to the Social Security cap of 176,000. So that is Social Security cap is federal law. So you'll see that that can change when the federal law changes as well. And this total premium rate covers both family leave and the medical leave. And then the paid leave is using the same online reporting as the unemployment insurance. And wages will be reported once a quarter using the unemployment if we are going that route through the state. Okay, next slide. So what are you going to do to get organized for this leave? Well, you're going to complete a census. So an Excel spreadsheet with all your W-2 employees and submit to the insurance company. You'll be working with your broker on doing this. If you don't have a broker, you can surely call us at King & Companies and we can help facilitate this and become your expert on this. And so it's all W-2. So even though you might have a group employee benefit program that's eligible for employees that work 20 hours or more a week, or 30 hours or 40 hours if you're under 50 employees, then it's even those employees that work, a few hours a month or whatever. You want to capture all of the information. And then what happens is that information, so like job title, gender, date of birth, what their income was from last year, or their hourly rate, all of that information then is submitted to the insurance company. And then if you currently have a short-term disability plan or a long-term disability plan, the insurance company will want to know that so that they can determine how those benefits will change. And we're also seeing that as the state plans, which have to be approved through the state, and these are just kind of getting approved now, each insurance company has a little bit different rules. So some insurance companies will say, oh, we're not covering if you have XYZ percentage of your population that are all female and childbearing years, we're not even going to offer a rate. So you're going to have to go to the state plan. Or if you have this particular industry, or if you, in order to get our great insurance rate plan, you're going to have to buy 4 other things from us, such as voluntary short-term disability or long-term disability or life insurance or dental or vision, or it could be supplemental benefits. So the insurance companies are putting on some rules so that you would maybe have to purchase other products in addition to getting their lower rate if their lower rate is available. So you want to get all this summer, you want to get all your census data done and submitted for the insurance companies. And then sometime this summer, there will be some type of documentation that you will either go to a portal website through the insurance company to kind of like create the account and then upload documents and things. So, more information will be done, I believe, available sometime in mid-July. And then December 1st is the employee communication, and January 1st is the benefit start date. Okay, next slide. So, most of these laws that have been passed in the last few years, and there's more laws like all the Minnesota health insurance mandates that were passed, but most of these laws apply to all size employers. Equal pay, leave rights, worker protections. So this is all about the worker, these laws. And the employer should review your policies, and you want to get this stuff updated, or at least kind of earmarked to update, because if you have an employee handbook and you address your short-term disability or your FMLA leave, if applicable, or any other type of leaves you have, then you want to kind of earmark those because you're gonna need to get those updated. And then state resources and compliance guides are available online. However, they're still kind of working on some of that as well. So even though we want all the information right now, they are still developing some of that information. Okay. So again, here's the timeline. So July 1st of 2023 was the non-compete ban, and the breastfeeding ban or breastfeeding location. Then August 30th, 2023 was the cannabis in the workforce and the captive audience, the meeting law. January 1st of 2024 was the pay history and the earned safe and sick time. And minimum wage changes and salary range on a job application for pay transparency was January 1st of 2025. Worker misclassification for overtime was March 1st of 2025. And then our big, beautiful bill is the Paid Family Leave Law and the Secure Act, January 1st, 2026. Next slide. So that is all. Now keep in mind the session is closed now. However, if there's any type of special session, some of these things can change or can get kicked down the road. But this is the highlights that we have as of today.
Sandra, we can't thank you enough for your information, for the resources, your knowledge on these subjects. And we just wanted to bring them all together. 11 workplace mandates in 3 years is a lot. And the communication has not been fantastic on these. So a lot of people don't know. And quite often small businesses have been exempted from these things. So we just wanted to make sure we captured them in one place, had our local expert here to share what they mean to you and your business. And I think what I've learned from Sandra in this is when we talk, especially about the Secure Choice Retirement Plan and the PFML coming up in January, is that the state option is one option, but there are private options, and that's where this summer is really important, that you should be meeting with your insurance provider, with your HR specialist, with your retirement plan people, and making sure that you have the best fit for your business. So anything to add, Sandra? Did we miss anything?
Nope, I think we're good.
Great. Well, thank you for joining us for the Burnsville Business Briefing, and we hope you'll join us on June 6th for the legislative wrap-up, and we will see you again soon.